Welcome to ABELMed, EHR-EMR/PM version 11, by ABEL Medical Software Inc.
Well, good morning, afternoon, or evening, and welcome to our demonstration webinar. ABEL Medical Software Inc., the developer of ABELMed EHR-EMR/PM version 11, is a Microsoft Gold certified partner. We use the latest Microsoft .NET technologies, and we're well positioned to offer the best value to physicians for their investment in our products and services. ABELMed is amongst the first batch of ONC ATCB 2011-2012 certified software by CCHIT. We achieved CCHIT certifications since their inception, their certification program, and we are the first EHR product to achieve CCHIT certified 2011 comprehensive certification. ABEL Medical Software Inc. also offers a one-stop solution for software and related services that includes any required hardware at cost. In addition to software, we also offer on-site and online training, 24/7 365 telephone support, and a range of associated services that include patient practitioner portals, remote backups, backup data verification services, as well as remote computer monitoring and administration. Our exemplary and personalized pre- and post-implementation support and efficiency in customizing our products to suit the workflows of a variety of practices makes us the ideal choice for small and medium-sized physician offices. Furthermore, our comprehensive and fully integrated practice management software optimizes billing and practice administration.
Security. Control access to any functionality and protect your patient data.
So probably the most important thing to talk about before anything else gets discussed is security. I mean, you have to have security on your system to make sure that the appropriate people have the appropriate privileges, and those who shouldn't have privileges to do certain tasks are not able to do so. This is a key step towards complying with HIPAA and with just in general protecting your patient's data and patient personal information. So for example, as you can see here within the Authorization Manager, I have a listing of all of the people who are using our software in the practice. As I look at, say, Dr. Peters, I can see over here on the right-hand side, I can see all the things that he's capable of doing. Now, because he's a physician, he has every privilege listed under, say, the encounters area, where he can add an encounter and pretty much do anything he needs to. Whereas, for example, a medical assistant doesn't have the ability to sign off the encounter for obvious reasons, and reception staff might not have any access to encounters at all. Now, it's always possible to adjust privileges and make sure that, for example, certain receptionists might have the ability to add encounters, but perhaps not all of them. And that's where roles and members actually come in. Members can be placed into a role, making it very easy to set the privileges that they possess, but at the same time, individual members can be granted special privileges. Within here, everything is also being audited, and certain users will have access even to the auditing reports. Even those people who are actually logged in and performing functions they're allowed to do, everything is being tracked. It makes for very, very strong security. And as a Microsoft Gold partner, we leverage some of Microsoft technology to basically map the users, the members here, to users within Windows, so that you can have literally a single sign-on without having to memorize another password.
Physician dashboard. Know what you need to do and when you need to do it.
So when you first open up your ABELMed program, it's going to open to this convenient screen here, the dashboard. Now, as you can see, I can switch between different providers, but the logged-in provider is my default. I happen to be logged in as Dr. Gordon Peters here. You can see that I can see a list in the upper left of all Dr. Peters' appointments for today. I can see all of the lab results that have come in for him. If I need to check any of them or review them, I can do so right from here. Down in the bottom left are all the notes that require signing. From here I can actually open up the encounter to review it, or I can sign it off right from here. In the bottom right, you'll see that we have all the tasks that are assigned to Dr. Peters. In the outbox, we would be able to see all of the tasks that Dr. Peters has sent to other providers.
Patient record. Access to all the information you need on your patients.
Now, a handy aspect of the dashboard is that you are able to access the patient record of anything you want with respect to any of the patients that are, say, on your appointments for today, or perhaps a patient who has a lab result and you want to go to their patient record as well. But certainly if you want to access a patient record that's not on your dashboard, you can just go here to File and Open Patient. And as you can see, all the normal methodologies for searching for a patient are there. For example, the last name and first name, but you may have noticed I can also search by phone number. I can look up my patient. I can confirm that she definitely is the right one by perhaps looking up her patient ID or her date of birth. And then I can open up my patient. Now, one of the most useful tabs within the patient record is your CPP, and that's short for Cumulative Patient Profile. But what it really means is it's basically just a quick sort of summary sheet of your patient's issues, and you pretty much have everything right here at your fingertips. What I think they call a face sheet in sort of more colloquial parlance. And as you can see, we got a quick list here of, for example, Debbie's allergies and some family history, the medications that she's on, that sort of a thing. And we can expand any one of these windows. For example, I could go to her problem list so that I could see exactly what problems she has. I can expand this window, but if I double click on it, then it fills the whole screen, and I'm able to see everything that applies to any of these items here, including I could show the resolved problems if I had to, so that I could see anything that used to be a problem for Debbie and isn't anymore. And all I do is double click to bring it right back to where it was before. Now I can customize this screen as well as much as I like. So for example, I can say, well, I would like the medication summary to be in a more prominent position, like over here, and so I'll just move the medical and surgical history out of the way. And as you can see, I can completely customize this to my needs. Maybe my medication summary needs a little bit more room. Now, I can add other windows into this screen as well. So for example, I could add in risk factors as a window and fill it in down here. I might also want something else down here, like health maintenance. That would be a really good example. Alright, so this way, by having the health maintenance here, now I know that Debbie is a diabetic from having looked at the problem list. I can set up alerts in the health maintenance area, which I can see she's already quite overdue for her tetanus diphtheria shot here, so that I will know the next time that she needs anything to do with any of her continuing care. So as you can see, I can rearrange this information. If I want it only on a one-time situation, then I can leave it as is, and the next time I open up the patient's cumulative patient profile, it will look like this. On the other hand, I could also save the layout. I can say that this is my default layout. I can also say that I want to save this layout for all physicians in my group. And of course, it is possible to print the CPP, so that you can have a quick clinical summary.
Patient encounters and progress notes. Record information any way you like, quickly and accurately.
So there's no question that one of the biggest challenges with using an EMR is to make sure that you're quick and efficient about documenting your patient visits. So ABELMed has found a lot of ways to make this seamless, efficient, speedy, setting up patient notes very quick and simple to use. We can template certain visits, making it nice and simple. You can see here how we have produced a number of templates that are already ready for you to use. These are packaged with our program. We use over 100 of them, shipped right out with the product. Any of these can be modified for your needs. You can open up one of our existing templates and change it to suit your needs. You can add new templates. It's very, very simple. Create it from scratch and basically make it your own. Now, in practical use, the nurse can open up the patient's record and actually start the encounter herself. So I can click New. I'll actually get this started. So I can have the nurse record things like the reason for visit, for example, which could be put down in a narrative format, or if she could select the template right here, if that was appropriate. I'm going to record this as basically being a diabetic follow-up, since Debbie is a diabetic. That's probably the reason that she's in here. Perhaps the nurse could also contribute something like, by taking vital signs, perhaps I could take Debbie's blood pressure. And you notice that I get an alert right away saying, wow, that's a really high blood pressure. So the nurse can follow through with some of those things. She can even say, hey, I want to set the sign-off as being required by Dr. Peters, because I definitely want him to sign off this note. And then she closes the note and saves it. And it has been started, but now Dr. Peters will see that there is a note on his dashboard that requires signing off. And we'll have Dr. Peters pick up this encounter where she left off. Dr. Peters comes in and he sees that there's a note from Debbie Abar in his notes requiring signing section here. So now the doctor has Debbie's encounter that was started by the nurse, and now he can go ahead and add to it. Now, we at ABELMed certainly recognize that doctors are a very diverse group and they have diverse needs, so we allow for multiple ways of data entry. I was pointing out before the idea of the template, so the template is certainly a good structured way to add data. We can go through some of the list of the things that she needs to comply with. I can actually add things in here as required, but I can also just quite simply go through a list of her systems, so I can say, everything is normal, and perhaps make certain notes about the heart rate, that sort of a thing. I can put in qualities, get added into the system, etc. And another thing that is handy, you can certainly do voice dictation with voice recognition software. I can record her diagnosis. I can set up a diabetic plan for her, follow-up appointment in 3 months. Now, if I have anything I want to say that is completely separate from the nature of the template itself, I can certainly add in some information purely in a narrative fashion. I can actually just type it in. For example, as you go along too, you may have noticed that over here on the right hand side, it's actually building the note exactly how it will appear when it's complete. As far as the follow-up appointment in 3 months that has been added here, I can right-click to add a task, send that directly to the reception staff so that they can arrange for that to be taken care of. I can even say this is really high priority, but I want it done within 3 months. And there you go. Without even having to worry about it, I sent off a task that they can follow up on. Once we've completed that, I can even sign off the note. There's certainly no reason at the end of all this that once I've closed off the note, I have plenty of access to get back into the note later on and be able to make any modifications to it that I wish. Now, all modifications are being tracked even after the sign-off. Okay, so now you can see here exactly how it's going to look now that it's been completed. A much more verbal format, prose perhaps format, than the template would initially have you believe.
Prescriptions module with SureScript certified e-prescriber. Quickly and easily, prescribe and transmit your patient's meds.
ABELMed is SureScript certified, which means you can send your prescriptions by e-prescribing. Definitely electronic prescriptions saves you a lot of time, and it's better for your patients as well in a lot of ways. ABELMed makes use of First Data Bank for its drug database. This means that you'll constantly be getting updated information on your drugs and alerts for possible interactions, thus increasing patient safety. Now, as you can see, I could go searching in my drug database for all of the many matches for the drug name that I just put in, but what we tend to do is we suggest to our users that they maintain what we call a popular list. And a popular list is a list of about 20 or 30 meds that you prescribe on a regular basis. Now, it's possible you could have more than one entry for each drug if you frequently prescribe that drug in different ways. And let me show you the popular list at its best. So I've just created a prescription type finding within the encounter, and I can just go typing a little bit of the drug, and it will show me not only the matches from the first databank list, but the two from my popular list. And the popular list items are spelled out in much greater detail, like with the frequency and dosage and number of refills, etc. So there is a lot that I can enter in with the popular list with just a single click. Now, if I needed to change something about the item that I just put in, like for example, we're going to give this patient some refills, it is possible for us to modify things that have been put in by the popular list, but the intent is that it's going to be a quick sort of a macro, shall we say, to get you into the prescription. Now, in this case, this patient is coming up with some alerts. For one thing, there are some drugs that are not being given alerts for. The same thing would happen for things like bee stings. But you'll see that there's a drug allergy in question here, and there's also some duplication therapy. And in some cases, like this is a geriatric precaution, so there might just be certain conditions like a patient who might be pregnant or anything like that. So basically it's just checking a lot of available information to run drug alerts for you. Now, it is possible for you to override the alert and then set a reason for why you have decided to go ahead with this drug, but you could also just go back and pick another drug, of course. Now, the alerts can also say how high a level you want to see of interactions. Maybe you don't want to see any of the little minor ones and are only interested in the very big ones, and then you can make those your defaults if you're so inclined. Now, once the drug has actually been entered in and saved as part of the encounter, we can also refer to the RX tab for an even more detailed view of the drug and various things. We can see the patient's adverse reactions and allergies over here. We can see the patient's medication history. You can also prescribe meds from here if you're so inclined. One thing that's kind of interesting is whenever you hover over any of the drugs in the medication history, you can see all of the details that in a tooltip, basically indicating who prescribed the med and any changes that might have been made to it. Now I can actually hit this print send button, and you can see here that by definition, since we have this patient set up for e-prescribing, it's defaulting to the idea that I'm going to send this as an electronic prescription. I'm just going to actually uncheck that so that I can show you what the prescription actually looks like when you print it out. You can also print instructions for the patient, and those are kind of cool too. They come straight out of the first data bank list, and it's basically intended for patients. So now I can click OK, and it's going to print those for me. Okay, so you can see here that we've got all the patient medication instructions for the amoxicillin, and here's the actual prescription itself. And as you can see, it has all the information that the pharmacist needs to fill the prescription. Oh, and while I'm at it, back here in the RX tab, I can actually look directly at the drug information that was supplied by First Data Bank, and that can be referred to at any time by the doctor. Renewing meds for a patient is just as simple. I can highlight the items that I need to renew, and I can do multiple meds at the same time just by clicking the ones that I want and hitting the renewal button. It'll ask me for sure that I want to go ahead with this, and I can say yes, and it will renew each of those for me. Now that you see they've changed to being for today, I will also see them on my print list to be sent. And that's ABELMed's prescribing module with SureScript certified e-prescribing.
Orders and results. Process diagnostic orders and receive results electronically.
So as you recall, one of the important functions of the ABELMed dashboard is the investigations, where you can actually see lab results that have come in from Quest Labs or from any lab actually, and you can also generate your orders right from here and see which ones that have been created by you or by all physicians, in fact. You can even show the ones that have recently been closed, which can sometimes be kind of handy. When you're looking at results, you can actually jump right into it right here from the investigations section of your dashboard. But what I'm actually going to do is I'm going to open up a patient so that we can have a look at some of the more detailed functions. You get a much more detailed view from here within the Investigations tab, but pretty much everything you can accomplish from here you can also accomplish from the dashboard. It's just a bigger view here. Now, orders can of course be generated, and they can be done right here from your investigations tab or from the dashboard. And most people like to set up order sets so that they can group many of their common tests together. When you receive the information back, as you can see, for example, we've got some abnormal results here, and they're very clearly flagged as abnormal. And I can click on some of the results that I see down here, like for example this cholesterol result, and then I will get a handy little graph that shows me exactly how Theodore's trending has been doing. I can also shift around to doing other tests while I'm in this window. Okay, so for example, I can look at his glucose levels as well and see how those have been doing. While I'm here at the spot, I can even link to my patient's patient education information. This is the sort of thing that could be printed for a patient sort of on the fly, if you felt the need to make sure that a patient had such information handy. Any of these kind of trending things can be adjusted, and you can change the dates or anything like that to get a bigger picture. I can also add an alert for this patient. I can link to its associated order. I can send a task, say, to my reception or something regarding this lab report, maybe that I want to get the patient in, or maybe I want to send the patient a reminder of something they need to get done. I can also add a comment in here. I can say, wow, this is getting better or worse. And notice how my note gets captured right here. I can mark it as reviewed by me, and I can also mark it as signed off. And all this information keeps accumulating within the actual record itself, so that I can always see, hey, it's getting better and it's been reviewed by me. There's one that was signed off. So all of your labs and your orders and your results are very carefully tracked by ABELMed.
Task tracking. Assign and delegate tasks, then track progress and status.
Without a doubt, one of the biggest challenges that all medical practices face these days is trying to figure out how all the myriad number of things that need to get done are going to get done within a timely manner, and can feel confident that all of those things are taking place. Now, certainly any kind of a task system does need to be integrated into every part of what you do during your day. Now, you can see that the tasks in the bottom right is a significant portion of your physician dashboard. And, you'll also notice that I can create a task at any time. For example, based on a lab result that came in, for example, Jerry Berger here has an abnormal lab result. I can add a task by clicking on this button here, and I can send that directly to my receptionist and say, we really need to get that patient in to review the result. So as you can see here, it's an appointment task. We want to get the patient in, and I want this to be done as soon as possible, so I'm going to set it for next week as a due date. And I can say OK, then maybe I can even make this high priority. I'll say OK, and that sends that task off to reception. And here's another really good example of a task that's very well integrated into the encounter, for example. So if I'm in the middle of this pregnancy checkup template and I want to book a follow-up appointment in 2 weeks, well, all I have to do is right-click and add a task. And once again, I can send that off to, as you can see, defaults to reception to book a follow-up visit in 2 weeks. And I can set that now for 2 weeks in the future, and then send it off. And it's as if I hardly had to even break stride while I was performing my encounter. And now you can see here, as I've logged in as the receptionist, now I can see that the 2 tasks that I just created are actually on her dashboard underneath the tasks. And I can even open up these tasks, open the patient directly here from the task and see anything I need to know about the patient. And I can also complete the task, or I could just open the task and maybe make a few notes about it. Perhaps I can even enter in the date that the appointment was booked and say then that I have completed the task. immediately the task will go off my list. I can do the same thing for the other task that was created. I could even just mark it complete by using this completed button right here. You'll notice that there is one task here that is drawing my attention because it's in bold. The other task that I set as high priority, you can also see here, has got a red exclamation mark indicating that it's higher priority than the other. So basically you just have a lot of capability to set tasks as being urgent, and it's very clear to everybody when a task is overdue. Of course, you can even sort these tasks based on their urgency, filter them based on their urgency, show me only my truly high priority tasks. I can sort them by date or by task name in any way, shape, or form that I like. So you don't have to be running around and putting sticky notes on everybody's computers or anything like that. You have to run from your exam room to reception to catch them and just make sure that they do something. Now it's a secure internal message. You can keep track of the tasks that you've sent to other people and to the ones that have been assigned to you and all the things that you have to do to finish your day. So, very efficient in managing.
Clinical quality measures. Record all the information required for meaningful use. Clinical quality measures, as part of your regular day.
Using your everyday workflow, ABELMed allows you to capture all of the meaningful use statistics, quality measures that are required to qualify for funding. And let me demonstrate some of the items here. Should be able to get it for correct time frame, and then basically, as you can see, all the quality measures are laid out here, complete with all the exclusion criteria, etc., etc. So let me just run it, and I will hit my calculate. You can see it gets to work right away on exactly the numbers that I'm looking for. As you can see over here, for each of the reports, I get a list of all the names. I get the people who have excluded from the list and those who matched. As a result, that gives me a performance rate, as you can see down here, of 40%. And all of the other ones, for example, there's a 100%. Let's see some more here. Here's one that's at 66%, and then I can click this export button here to create my export file. I'm going to export it into the data folder, and then it will go off and generate the report that I need so that it can be sent in for funding. And interoperability is never going to be a problem. You're always going to be able to export documents on your patients. For example, if I wanted to create a CCD for Debbie Abar here, I just click export. Be able to send it to the documents folder where I'll be able to retrieve it later. It's going to export all of her relevant information. I can even encrypt it if I'm so inclined, just in case you need that extra security on the document itself. Alright, there we go. As you can see, once we open up the document, we get to see everything about it. Here's Debbie Abar and her address and all that other information, and things like her allergies and adverse reactions, medications, etc. Oh, she had an appendectomy. So all that information is all set to be transferred to another provider or whoever is required for that to send that information.
Reporting tools. Retrieve your valuable data for strategic analysis and healthcare management.
ABELMed has a great number of built-in reports. We even have reports that allow you to call up patient recall lists. So for example, I can get a list for all of my seniors patients perhaps who need to come in to have their flu shot. We also have a report generator that can allow you to generate a number of demographic reports right within the system. More importantly, since ABELMed uses SQL Server as our database management tool, there's all kinds of reports that I can design right here on the fly. So for example, I could throw together a quick report right here that's going to show the following information on the report, and then perhaps I could put a filter on it here. Perhaps what I'll do is I'll pick a diagnosis code, and I can even be so specific as to say I just want it to contain, so that it might have any sort of variety of diabetes codes. And when I say OK to that, it's going to look basically for all of the patient's names and IDs and genders and date of birth who are diabetics. So now when I run this report, you can see that we get our results. And all of these results are completely sortable and filterable. The power contained within this report builder is very, very strong. Now, when it comes down to syndromic surveillance, one of the things that's difficult for me to illustrate basically about the ABELMed syndromic surveillance functionality is how it actually gets generated, because it is in fact automatic. So from a user perspective, as soon as a diagnosis is entered into any patient record, the relevant HL7 messaging to the right organization is generated automatically. The user requires no intervention whatsoever, and it's difficult for me to show you except for the fact that there are all these files here that have been created by diagnoses in the last day or so. So that brings us to the end of our demo, and I hope you've really enjoyed it. And I just want to say, this demo just scratches the surface. It would be very hard to demonstrate a full-featured product like ABELMed in so short a time as we have here today. But just to quickly mention some of the other important features that I didn't have time to cover, we also do patient's vitals graphing, which is especially important for children, with height and weight growth charts, that sort of thing. And we have links to access to patient education materials, immunizations, disease management flow sheets, document scanning and storing. I could probably just go on, but overall, just thank you very much for your kind attention. And that was ABELMed version 11 by ABEL Medical Software Inc. Thank you very much.